tonight we've just heard that the British Prime Minister has just been moved into intensive care. So I really wish him well and hope that he comes through this okay. It's slightly worrying that he is now obviously in intensive care, so I do hope that he pulls through okay. So thanks again for coming back tonight. Tonight we're just going to have a really quick look at what's going on and update you on some of the data. So we've seen about coming up to 11,000 deaths in America now, which is 1,000 of those in the last day, which is concerning. I have to say they certainly have increased the number of tests quite significantly, and it looks like they've actually done the most tests than anybody else. So they're now up to nearly 2 million tests across America, and that works out at about 5,657 tests per 1 million of the population, which is pretty good. Obviously, if we look at Germany at 10,000, nearly 11,000 tests per million population, 11,000 for Italy and 7,500 for Spain. So the more testing we do, the closer a better picture we have of what's going on the ground, so we're able to allocate resources and work with isolation techniques and identifying clusters. And managing coronavirus is obviously quite challenging, and we've seen that in India particularly. So India is obviously a huge population, and there's about 460 million people who are currently in some type of displacement in India at the moment due to the very short notice of the lockdowns that were applied across India. So when the leaders in India decided to put a national lockdown on over 1 billion people, there was very little preparation time. So there was a lot of people who were working in other parts of the country who then needed to get home, and all of the transport was stopped, all of the buses and all of the opportunity for a person who was working in an urban area was suddenly very limited to get home. So there is this group of people who started walking for miles and miles and miles after being told that there was a lockdown, and then this ensued with violence because people in police were saying you need to be at home, there is no quarantine, and people were saying, well, we're trying to get home and there's no public transport, so we're walking and it's taking days only to be sent back to the towns and cities from which they were originally moving from. So a lot of difficulties with the movement of people over in India, and a lot of difficulties in managing that. So India looks like they have about 4,000 cases and 136 deaths in total. But I think India is a really good example of a country that has a lot of challenges. And this is public health challenges, the movement of people, adequate surveillance, adequate healthcare and PPE, and all kinds of public health challenges. So when it comes to something like a population level outbreak or pandemic or any kind of infectious illness, there are going to be so many challenges with recording that data, with monitoring that, with keeping people safe and well in hospital, with getting people tested. Obviously, geographically, it's a huge place, and population-wise, it's a very big population. And socially and culturally, there are so many challenges with different systems and the way in which certain groups and subgroups and populations treat each other, and all of the social stigma around that. So there is a lot going on in India, which I think is going to be very, very challenging, and I personally don't think we will ever see the true extent of what's actually happening on the ground in India, because the surveillance just is not there, and the challenges of getting adequate surveillance is going to be very, very, very difficult. The other thing is the ships. Now, there's a lot going on with ships at the moment across the globe, and we obviously had those 2 cruise ships that docked into Florida. So the Floridian government did let them dock in the end, because if you remember back, I did say I wasn't sure. The governor there had said they didn't want the ships there because they'd managed to clear 30% additional capacity in their hospitals for residents of Florida, and there was some difficulties about accepting additional patients through these cruise ships, because there was thousands of people on these cruise ships. I think on the Zaandam alone there was about 1,200 British people. At the moment, those who have been tested, at least 12 of them have come back positive. So if we've got 12 positive cases, it's probably very likely that there are other positive cases which will turn up as the testing goes on. Additionally, we've got all the challenges of that incubation period as well, because obviously anywhere between 5 or even 1 and 14 days is at least 1 to 14 days, and obviously we know there's been cases a little bit longer than that too. So given the incubation period, it is likely that there will be more cases presenting over the next couple of weeks as well, which is problematic because I'm not totally clear yet on what exactly is happening with those passengers, whether they're being flown straight home to their home countries to be quarantined, or if they're going to be quarantined in Florida. So it's definitely interesting. We've also seen a Navy vessel being taken out of commission. So the USS Theodore Roosevelt has actually been taken out of commission on the 31st of March. They started taking passengers or sailors and the crew members from the aircraft carrier into Guam, and in order to protect existing sailors. As obviously on a space like that, it's very confined. Applying social distancing is going to be super challenging, and it's just a ripe environment for spread, isn't it? I mean, if we took even just the Diamond Princess as an example of that, it's going to be really difficult to contain an outbreak on such an enclosed and confined space. And just finally, there are 2 ships that are quite interesting to watch as well. Over in America, there is hospital ships, and over in New York, there is one hospital ship called Comfort, and the other one is Mercy, which has been deployed over to California for residents in California. And the purpose of these 2 ships is really to help hospitals on the ground and helping people who are not currently positive with COVID-19 have a space in which will hopefully remain COVID free. But obviously the testing is a huge issue, so actually the ship Comfort has started testing people who are going to be theoretically put onto that ship on the pier. So there is some of that moving into what was originally going to be a completely clean zone. But it's interesting. So these hospital ships are quite interesting, and hopefully they will be helpful and support areas who do have a large burden on their healthcare system at the moment. So thanks very much for watching. If you caught this, I appreciate it. Please do subscribe, and I will see you tomorrow for another update.